Today on the 6th of June, I have started off, you know, I just decided to start off with a session which is slightly different than, the other sessions that have been broadcasted previously on the Finish Line School. So today's session is something that, I decided that I'm going to keep it very, one would say slightly different from what we've been dealing with. Today's session is basically something that relates to both our health and the environment at the same time. All right. So, one of the matters of major concern last week on the same day we had the anti-tobacco day. All right, and I went with the IDA Chandigarh branch to Sector 17, where we had this wonderful. Sort of we can say a rally sort of thing. We rallied all around Sector 17, and the surprising part was that when we were crossing the car parking, there were these two guys who were smoking right there on our face, with us holding all these banners, that quit smoking, it's time to leave smoking, and right on our face we had these two people smoking. So immediately a very senior member of the IDA just stopped right there and said that finally we caught you. So they all they did was they smiled back, and one of them put his cigarette down and the other one started rubbing it into a sort of an ashtray that he had made right there sitting there. So it was funny that in our city Chandigarh you generally there's a huge fine on public smoking, right? That is very much existent in case they finally catch up with you doing the same. What happens eventually is that you have to end up paying the amount, right? Because Chandigarh is already famous for its police force being a bit strict. So, putting all of this aside, why is it a matter of concern? How does smoking harm the environment? Now, you may think that, come on, human beings smoking doesn't really contribute to any kind of environmental pollution. Does smoking contribute to environmental pollution? Perhaps not. Perhaps not in a big way, but considering that we as human beings are essentially and at the same time an equally important part of this environment, right? When we as human beings are an equally important part of this environment, it becomes, this becomes a matter of concern that has to be tackled at all levels. It's not just that, smoking and tobacco are going to cause oral cancer. Eventually, when most people who are into smoking and tobacco are going to have a different sort of effect on their mind which occurs due to nicotine, that will in the long run somewhere have an adverse effect on the environment, since we ourselves are components of the environment itself. Now coming to the main topic, that is kick the smoking habit in the butt. Now why did I use that word? Because all cigarettes have a butt, so once you kick off the habit in the butt, you basically have to decide that this is one habit that I just have to leave, right? You can't say that okay, I'll gradually leave this habit. That's how most of these addictions generally end. You gradually end up leaving them. A person starts smoking, then he comes a chain smoker, then generally they are advised either to go on to nicotine chewing gum, to keep those nicotine levels within the body sort of maintained for a while, and then gradually reduce it down to a level that is more, in a way, layman terms, affordable to the body, right? And then gradually trying to wean it off at a later stage. But the point is that why start this habit at all? Because this is one habit of concern that very few people are actually able to leave, even with the help of the best medicines or the best anti-addiction formulations. There are very few people who are actually able to leave smoking. बहुत कम लोग हैं जो कि स्मोकिंग को छोड़ पाते हैं. अब इसके पीछे हमें कारण देखने होंगे. We have to go behind and we have to see that what exactly is the reason. Why does smoking start in the first place? How does it progress? And what is the exact point that a person has to decide that I want to keep on smoking or I want to leave smoking? What is the critical point at which a person should actually leave? I think one thing that Surya is also watching this, he always says to anybody he meets who is smoking, is that anybody who's smoking is that basically the effects of smoking are going to last up to 15 years. So you're going to be at the risk of having lung cancer or oral cancer for the next 15 years from the day that you leave smoking. So for example, a person A leaves smoking today. Alright. A person A leaves smoking today. So for the next 15 bloody years, he is at the risk of developing not just oral but definitely lung cancer at any point. Because that is the level to which your cells inside the body, be it the oral cavity or the lung, are affected. I am talking in a very plain language today because a lot of people who may join my live session may not be into our field, right? But they do need to understand that in case they're into this habit of smoking, that's the kind of risk they're putting to themselves. It's just not worth it, right? It's just not worth it. Now, coming to the point, how does smoking start? 90% of people say that smoking starts because of peer pressure. Agreed. It does start to a large extent because of peer pressure. A lot of people start smoking in high school. That's true. And most of them generally start smoking in the first or second year of college when it's, it's really cool to be in that part of that, group that sits down to drink or smoke or do any kind of dope, right? So it's a cool group to be a part of. And to be seen smoking at one point of time, although nowadays the awareness of health the awareness with regards to health has become, so wide that most people are actually trying to quit this habit. But not very long back, around 5 years back, it was really cool to be seen smoking around, right? As far as now, I am not passing any comment which is, likely to sort of hurt, female sentiments or someone, but I have seen that, often girls start smoking to challenge the men. It's been seen very often that, the only reason girls actually start smoking is because sort of as a challenge to patriarchy that already exists in our society. Fine, there are other ways to challenge that, right? But you don't have to start smoking and, screw your lungs up. Alright. So, that's where smoking starts off. Smoking starts off as a basic, lack of, one would say, willpower maybe, at the stage of adolescence or at the stage in which you've just joined your college. Alright, so that is where the story starts off. For very few selected people who have actually been raised in extreme poverty, for these people smoking starts off because the reason of hunger. So I can somehow, although I don't want to encourage it, I can somehow understand their reason of smoking, right? Hunger is something that I am personally yet to experience. I have gone without food for long periods of time, but hunger is something absolutely different. Starvation is something different. I haven't experienced it, so I won't comment on it, that what kind of changes it brings about in the body. A lot of laborers are seen with oral cancer, and the only reason, in the end, if you actually interrogate them or question them or try to investigate them, the only reason that comes out is that, साहब खाना time पे नहीं मिलता, इससे ना थोड़ा दिमाग सेट हो जाता है थोड़ी देर के लिए. So that is the reason, in as far as the lower socioeconomic class is concerned, that people start off smoking. It's almost as if highlight electronic signature. Yes, sir, absolutely. So it's almost as if it's a substitute for food. So at that point, I cannot really blame them because neither do they have access to the kind of education we have. But we, most of us think, yaar, ye packet pe to likha hi hota hai, is pe to aata hai. But education is not about reading that sentence. Education is about trying to understand what is written in that sentence, right? So instead of simply saying, it's sort of that ways, community programs are helpful. We as doctors have always been trying to help as many people get out of the smoking habit. Whenever a smoker comes to our institution, at least whenever I examine or whenever someone who is with me examines, I always tell them that, encourage this person to go to the pathology department, oral pathology department, or the medicine department, oral medicine department, because they have this anti-tobacco quitting program, right? So that will help this person quit. I can tell you almost 80 to 90% of people are interested in those programs. They actually want to leave this habit. So this habit which has grabbed them like, an absolute python is something that, they all want to leave. So how does smoking start? I've given you two reasons now. One could be peer pressure in case of the upper socioeconomic state class, which involves, a status symbol sort of thing. and the other would be poverty and hunger itself, which compels people to rather than smoke BDs or cigarettes and sort of get rid of whatever hunger or whatsoever. Now this is how it starts. Now how does it progress? Once you start smoking, you are bound to form a circle with people who are smokers themselves, right? So there's almost this brotherhood or sort of in women sisterhood around smoking, that अच्छा इसके ये भी smoke करती है, ये भी smoke करती है, अच्छा, and constantly asking people कि भाई lighter है तेरे पास, सुट्टा है तेरे पास. The moment the cigarette is exchanged, अरे तू तो भाई है, आज से हम शुरू करते हैं. And this is how that smoker circle just begins to expand, and it's almost like the universe going into a big bang at some sort of space, and एक दूसरे को मिलता है, दूसरा तीसरे को मिलता है, तीसरा चौथे को. It's a toxic sort of MLM marketing in which people are just joining each other just on the basis that you are spoiling your lungs, so I am also spoiling my lungs, the third is also spoiling my, yay. So that way sort of people are getting together and they're all into this habit, and this is a toxic sort of cycle that starts off. So once this happens, once you're into that community of smokers where nobody else is a non-smoker, now there's no element of guilt left at all. Whenever you will be tense, you will go back to that circle. Now that circle will talk at a different level, because nicotine has already entered the brain cells, altered those brain cells, and anything that touches the brain, is bound to alter the entire thinking process. So once you become a part of that group, you will agree with what that group says, although common sense may not prevail at all. In that group. Alright, they may do some nonsense things, and eventually what happens is that within this group there will be different circles altogether. There will be a circle of smokers who occasionally smoke, who continuously smoke, the chain smokers, those who smoke the cigars, and those who have progressed from smoking to smoking these probably marijuana joints, or probably going into some hard drugs like pot, right? Smoking pot. So all those hallucinogenic drugs that you can think of. And this is the path to drug addiction. And the path to drug addiction is, my friends, the path to destruction. सीधी सी बात है. The path to drug addiction is the path to destruction. So most of these circles, you will find some very successful people. But what happens in the end? End में क्या होता है? इस पूरी circle में हम कहते हैं यार ये बंदा कितना कैंट है. He smokes. And ये सब कुछ drugs करता है, फिर भी he is doing so well in life. You see, your doing very well in life is more connected to your cognitive skills and your social skills and the level of intelligence that you have or you have developed over time. It has nothing to do with that smoke. So it's not that the person is smoking or he is cool, because he is intelligent, let's just try and become a smoker like him. Ask that person who is continuously smoking, needs to be highlighted, particularly dangerous for children. Yes sir, absolutely. Ask that person who is continuously smoking and meet that person after 5 to 7 years who's been smoking. In those 7 years, I just want you to do this small sort of study, alright? If you have a friend who's living close by, 7 years bhi chodo, just try it for 2 years, alright? A person who's continuously smoking and not ready to quit the habit. Encourage them to quit the habit at all times, alright? After that, just 2 साल के लिए उसके साथ रहो. You don't smoke. You build up your health. You make yourself a champion. Alright, you run, you exercise, you do whatever you do otherwise. Let that person do it as well. उसको कहना आपके साथ 100 मीटर की दौड़ लगाए. उसको कहना अगर 100 छोड़ो 400 मीटर की दौड़ लगाए. चलो 100 में तो कोई भी आगे पीछे हो जाता है. 400 मीटर की दौड़ लगाए. हो सकता है आप जीतो, हो सकता है आप हारो. अब उसको अगली बारी कहना 1500 मीटर की दौड़ लगाए. शर्त लगा लो. You can bet on this that he will be tired within 700 meters, he'll be blown out. That's how your stamina crashes when you smoke. Alright, 700 is anyways a higher bet. Probably if he was already an athlete, maybe he'll make it, but I'm talking about a person who's lethargic and smokes and claims to exercise every day. There's this category of smokers as well who claim that हमारी तो health fit रहती है, हमें तो इससे कोई फर्क नहीं पड़ता. I can tell you he'll literally be gasping for breath. Alright, बिल्कुल स्टैमिना खत्म हो जाता है स्मोकिंग की वजह से. Now, within the progression, as I've already been told that I have to, this is something very important. I want to highlight passive smoking. Passive smoking is worse than active smoking actually. That's what most studies tell. The toxic components of smoke that come out, of the smoker's lungs, the person who's standing right next to the smoker also gets equally affected, right? He also ends up developing the same receptors. Within each smoking group is this group of non-smokers who always hang out with that group, not realizing that the reason they hang out with that group is because they've been passively smoking all the while. Alright, वो पैसिव स्मोकिंग इतनी कर रहे हैं कि वो उस ग्रुप के साथ रह रहे हैं पूरे टाइम, वो उनको इतनी अकल नहीं हो रही, इतना रियलाइज नहीं हो रहा कि वो ग्रुप के साथ क्यों रह रहे हैं. वो इसलिए रह रहे हैं क्योंकि उनको तो चढ़ रही है इनकी. समझ गए? द सेम अप्लाइज फॉर पीपल हु स्मोक जॉइंट्स और marijuana. There is always this group of people who will always be there within that group of smokers that are into the habit of regularly doing it, because passively these habits carry on, and it is as injurious. Yes, Sahil, you're absolutely right. It is absolutely as injurious because of the reason that passive smoking also causes, it may not cause oral, but it causes lung cancer. It can cause lung cancer in the long run. You will develop nearly the same complications as a smoker. So in case you are in a circle of smokers and you don't smoke, so you think nothing is happening to you, please either advise your circle to stop smoking or take a hard decision and leave that circle itself. This circle is not going to do you any good. Yes, it is illegally sold. That's absolutely true. It's illegally sold. It's illegal in India. So just absolutely leave that circle. ठीक है, 2 दिन तक तुम उनको मिस करोगे, 3 दिन मिस करोगे, पर याद रखो उनके साथ रहोगे तो लाइफ लॉन्ग अपनी हेल्थ को एक मिस दे दोगे. राइट? कमिंग टू नेक्स्ट, व्हाट हैपेंस इन द एंड आफ्टर ऑल स्मोकिंग कहां को लेके जाती है आपको? वेयर डज इट टेक यू? It either takes you permanently to the hospital bed. Yes, it's a bad circle. It either takes you permanently to the hospital bed, where you will not get up after that because you've had lung cancer and you'll probably go off, or something happens in the smoker's life that just forces him to quit. पर ये नौबत क्यों आए? Why should this happen? Why should a big accident happen in a person's life for them to stop smoking? Or why should they land up in the hospital bed with injured lungs? I agree that nowadays a lung transplant is possible. I agree that a lung transplant is possible these days. But that doesn't mean that you have to go in for that lung transplant, right? Just because that way dialysis is available as well for kidney failure. But does that mean you have to start consuming high creatinine to injure your kidney so that यार dialysis तो है वो करवा लेंगे? यार इसी तरह लंग ट्रांसप्लांट है तो इसका ये मतलब थोड़ी है कि हम स्मोकिंग करते रहेंगे. दिस वाज समबडी सेड दिस टू मी वंस एज अ जस्टिफिकेशन ऑफ स्मोकिंग कि आजकल लंग ट्रांसप्लांट हो जाता है मैं वो करवा लूंगा. मतलब आई डोंट नो वेदर ही वाज ऑन हिज सेंसेस और नॉट व्हाइल सेइंग दैट, बट या व्हाट डू आई से नाउ. ठीक है, तो दिस टाइप ऑफ these great thoughts that you get from people, they really surprise you at times. So why do you want to land up there? The point is that you should just realize that every cigarette, especially if you're educated, the packet itself is telling you not to touch it. The packet itself. Tell me one thing, you have a high voltage wire in every sector or every place that you live. आप जिस डिस्ट्रिक्ट में रहते हैं हाई वोल्टेज की तार होती है, उसके आगे एक स्कल बनी होती है और नीचे देखो डेंजर हाई वोल्टेज. आप कभी उसको हाथ लगाते हो? उसमें मजा आता है हाथ लगा के? जिसका उसका थोड़ा सा भी, हाँ एब्सोल्युटली चूज रॉनी वॉकर ओवर मामलो, उसमें मजा आता है हाथ लगा के. मैं मजाक नहीं कर रहा. जो बाय चांस भी उस हाई वोल्टेज वायर पे किसी का इलेक्ट्रिशियन का भी हाथ लग जाता है ना, उसकी इंस्टेंट डेथ ऑन द स्पॉट हो जाती है. उसको तो हम हाथ नहीं लगाते. बट द मोमेंट यू लुक एट अ पैकेट ऑफ सिगरेट्स, स्पेशली इफ यू आर अ स्मोकर, देन व्हाई डू यू टच इट? इट्स नो मजा ओनली सजा. बिल्कुल सच्ची बात है. व्हाई डू यू टच दैट पैकेट? जब उसके ऊपर भी लिखा है कि ये भी हाई वोल्टेज है, हाई वोल्टेज इन अ डिफरेंट लैंग्वेज, राइट, इन अ डिफरेंट वे. व्हाई डू यू वांट टू स्पॉइल योर लाइफ बाय स्मोकिंग, राइट? So that's why I brought up this topic on World Environment Day. Now, Dr. Ranjan sir had just mentioned previously in the comments that I should talk about electronic cigarettes as well. Yes, there have been studies that electronic cigarettes, even hookah smoking and vape, have been found to cause lung damage. They have been found to change the structure of the lung cells in such a way that it has become difficult for children to breathe. There was this spate of children dying in Europe about 16 to 17 years old, because when vape first started off, it became an absolute rage in Europe. So there were these cases in which 15-16-year-olds were reported to the hospital, much before the COVID era, were reporting to the hospital with poor lung function. They were not able, the doctors were not really able to figure out what's causing them until they realized that even vape has the potential to damage your lungs. So taking any form of smoke inside always comes up with its own risks. Although one may claim that the hookah is cleaner or the vape is cleaner or something, but there is no point in taking smoke into your body anyways, right? So considering all these factors combined, passive smoking, especially in case of children, is bound to cause a lot of harm, because children are still in their developmental stage of the brain. Alright, so once this smoke enters into the lungs of the child, it's not just smoke but also toxic elements that are entering. They may cause severe retardation. Alright, and such children may not eventually progress in life, especially if their parents or somebody at home is smoking continuously. So in case anybody who's joined here has kids and smokes, I think today is the best day to quit. Today is the best day to quit smoking. And to quit any habit, especially that of smoking, the only way to quit smoking, I don't know about other habits, maybe you can quit them with practice, but the only way to quit smoking is to kick it in the butt. The only way to quit smoking is to really kick it in the butt and finish it off once and forever. You will have withdrawals, whatever. If you are having withdrawals, you can report to any dental center, you can report to any medical health center. They're going to help you get rid of this addiction. Take as much help. Don't be ashamed of taking help for this. Just take as much help as you want and finish it off once and for all. It's very important. It's not just a matter of your life or your family life, it's a matter of society as a whole, which has to be dealt with very firmly. So that's my session for today at the Finish Line School. If anybody has their own views or would like to join in right now, or has any other questions, you are absolutely free to ask me. Right now you can just post your views. I had posted another video with a few quotations that's on YouTube right now. You can go and view that video as well. I posted the link in my story, right? Thank you, Sahil. I posted the link in my story, so you can just go ahead and look at that link right there. Alright, so a few quotations along with a few pictures. Alright, one packet a day approximately is equal to 30,000 INR per year. Absolutely, sir, absolutely. I think probably it's far more than this, especially when you go to these big cities where the rates of cigarette packets are higher, and the more hi-fi or high-end cigarettes that you wish to purchase, the price just goes up. So you're definitely losing out on this money per year. But more than that, I would say probably the cost of a lung transplant would definitely not be less than 20 lakhs or 30 lakhs. Now, for somebody who is foolish enough to say that, मैं smoking कर लूँगा, मैं तो बाद में lung transplant करा दूँगा, probably doesn't realize that what he's just said, probably he's not in his senses, because the kind of immunosuppression that he would need for the rest of his life is again bloody. Just to continue smoking and spoil the other lung as well, right? So tobacco chewing is, yes, Surya, tobacco chewing is definitely worse. Tobacco chewing is definitely worse. And Surya knows it. And even most of you people may even know that there are very affluent people, well-to-do people, very well-to-do people and educated people who are into the habit of tobacco chewing itself. And they end up with oral cancer. They come to the operation theatre. A part of the face, I always say that it's a part of the face that is cut. Even though you end up stitching that part of the face, but the symmetry of the face is lost forever. And I can tell you it is very difficult to perform a prosthetic rehabilitation for such patients. Although we have all kinds of prosthetic appliances available, we have the obturators, we have the guiding flange. It's a very difficult life with these appliances. It's not easy to have. मुंह में रजनीगंधा, हाँ बिल्कुल सही बोला. It's very difficult to have. Sahil is also in our department of prosthodontics. He does realize that that it's very difficult for a patient to live with this appliance in the mouth. How would you like a metal wire in your mouth which guides your mouth to close into one place be there for the rest of your life? Why would you want that to be there for the rest of your life? Now, tobacco chewing is an entirely different topic with an entirely different etiology. Advertisements are there at the worst. I completely agree. Now, most of these products are sold under the coverage of Vimal Pan Masala. What type of Pan Masala, man? किस टाइप का पान खाने में डलता है? मुंह में रजनीगंधा कदमों में दुनिया, फ्री फ्लैप, बिल्कुल सही। ये हमने एक बार बनाया था कि मुंह में रजनीगंधा, मुंह में ओरल कैंसर, कदमों में दुनिया, बिकॉज फ्री फिबुला फ्लैप तो कदमों से ही लिया जाता है। ऑब्वियसली कदमों में ही तुम्हारी दुनिया रह जाएगी ना, वहां से तुम्हारी दुनिया बनेगी आगे, और नहीं तो क्या आगे जाके। और वो फ्लैप लगाना तो एक बात होगी, उसके बाद जो मुंह बंद नहीं होता उसके लिए goats, sheep do not touch tobacco plant. Absolutely, this is also a fact that multiple animals don't touch that plant. So वो closure पूरी life कराना। अच्छा, there's a guiding flange which is called a fixed guiding flange. Now imagine I put a wire into your mouth, I fix it to your teeth and I just leave it there so that it guides your mandible continuously to close. You see, this is something, because the unfortunate part is that most of the people who get affected by oral cancer are people who don't have any kind of access to education. And just as I mentioned, education is not about reading the sentence, it's about understanding what is written in that sentence and its long-term consequences. Most of these people live by the day because they're daily wage laborers, उनको रोज का पगार मिलता है, उसी में उन्होंने अपना घर चला लेना और दिन का एक एक कर लेना, अगले दिन तक उनकी कोई सेविंग नहीं होती। They have zero savings. उनकी सेविंग होती भी है तो इतनी कम होती है आप सोच भी नहीं सकते। तो दैट इज द ट्रेजेडी ऑफ अ कंट्री। But we as doctors have this huge opportunity to, make sure that these things do end. But, what hits you hardest is what sells best. What hits you hardest is what sells best. Be it tobacco, be it drugs, right? Awareness is the key, right? Absolutely, awareness is the key. But what hits you hardest sells the best. So that is why there is no way to stop the sale of these products. The only way is to actually guide people to quit these products. Now we keep saying that government इनको रोकती क्यों नहीं, इसमें बैन क्यों नहीं लगाती, बैन क्यों नहीं लगाती? कभी नहीं लगने वाला बैन, कभी नहीं लगने वाला बैन, ठीक है? Shall be dedicated not only to tobacco, every weekend shall be dedicated towards awareness. Absolutely. So बात वही है कि कभी इन पे बैन नहीं लगने वाला, because it's a big business. And for those who are trying, we'll raise our voice against this or do this, these should be shut down. These will be stories today. These will be stories tomorrow, and these will be stories even after 100 years. The only way to do it is to raise a certain level of awareness that at least 60% of the population, even if 60% of the population today realizes this and puts their cigarette down or puts their gutka packet into the dustbin, right? Eventually, society will become better and the world will be a better place to live in. Half of these nightclubs you visit, even if they start off, I would really, like to see that happen. That at least nightclubs should stop allowing people to smoke inside. Now you may say, रात का मजा ही क्या आएगा यार, उसके बिना तो फील ही नहीं बनेगी माहौल की, या माहौल नहीं बनेगा यार, वहाँ बाकी सब कुछ भी तो मिल रहा है माहौल बनाने को, उससे बना लो ना माहौल। तुम्हें जरूरी है कि तुम्हें सिगरेट पी के माहौल बनाना है, और जो 4 लोग नहीं स्मोक कर रहे उनकी लंग्स में क्यों आपने डालना है? जो 4 लोग वहां पे नहीं स्मोक कर ले तो उनकी लंग्स में आपने ये क्यों टार डालना? सबसे बड़ी बात तो वहीं पे ही आती है। Now hookah is the trend. Yes, hookah is the trend absolutely, because I think it's safe, whereas it's not. It's not probably it's not as clean as they claim it to be, because multiple people, even with नहीं यार, इतने एक्सट्रीमिस्ट तो मैं भी नहीं हूँ। आई थिंक बंदों को इतना एक्सट्रीमिस्ट तो मैं भी नहीं हूँ जो ब्यूटीफुल सोल ने कमेंट लिखा। बट ठीक है, बैन करना इज नॉट द सोल्यूशन। मैं वही बोल रहा हूँ, पहले अगर सेल्फ बैन कर लोगे तो उससे आपको कहीं बेटर रिजल्ट्स मिलेंगे। बिकॉज एक बारी एक इंटरव्यू ली थी इन्होंने, दे टुक एन इंटरव्यू ऑफ पर्सन ऑफ दिस लेडी हु यूज्ड टू मेक बीडीज, ऑलराइट। सो शी वाज टोल्ड कि आप बड़ी गंदी चीज बना रहे हो, उससे लोगों के घर बर्बाद होते हैं। बट तो काम हो गया वही बात है, से लोगों के घर बर्बाद होते हैं। तो कहती कि लोगों के घर तो बर्बाद होते हैं और मेरा तो पेट ही इससे भरता है। वी हैव टू फाइंड आउट, एंड साइंस कैन डू दिस एट ऑल पॉइंट्स ऑफ टाइम। साइंस कैन डू दिस एट ऑल पॉइंट्स ऑफ टाइम, दैट इट कैन एक्चुअली फाइंड आउट एन ऑल्टरनेटिव यूज फॉर टोबैको। It can actually find out an alternative use for tobacco. इसके कोई एक्सट्रैक्ट लेके, इसका कोई प्रोडक्ट बना के जो कि हमारे मेडिकल यूज में आ सके या किसी प्रकार के ट्रीटमेंट में इस्तेमाल हो सके, तो ऐसा यूज तो घर बर्बाद होते हैं। अल्कोहल से भी होते हैं, बिल्कुल होते हैं। अल्कोहलिज्म से होते हैं, अल्कोहलिज्म से घर बर्बाद होते हैं, ये बात सच है, अल्कोहलिज्म से होते हैं, बट अल्कोहल विद इन लिमिट्स तो आई डोंट थिंक सो इतना कुछ, उतना डैमेज तो डेफिनेटली नहीं करती जो स्मोकिंग करती है। स्मोकिंग तो देखो, कोई भी ओकेजनल स्मोकर नहीं होता, लोग कहते हैं आई एम एन ओकेजनल स्मोकर, ठीक है, लोग कहते हैं आई एम एन ओकेजनल स्मोकर, मैं तो कभी कभी फूकता हूँ, मैं तो कभी कभी फूकता हूँ, आई एम एन ओकेजनल स्मोकर, या बैन इज अ स्ट्रॉन्ग वर्ड, नो डाउट, आई एग्री। वो स्मोकर कभी उस कैटेगरी में होता ही नहीं है, कभी कभी फूकने वाला बंदा तो एग्जिस्ट ही नहीं करता, स्मोकर तो होता ही स्मोकर है। आई एम बिकमिंग वेरी रेडिकल राइट नाउ, बट ये बात सच है कि स्मोकर तो होता ही स्मोकर है, चाहे वो छुप के वॉशरूम में स्मोक करता हो, चाहे वो किसी पेड़ के नीचे जाके पार्क के अंदर झाड़ी के पीछे छुप के स्मोक करता हो, कहीं पे भी स्मोक करता हो, ठीक है, कहीं पे भी वो स्मोक करता हो, भाई स्मोकर तो होता ही स्मोकर है, ठीक है। ही इज एज गुड एज एन अल्कोहलिक। जस्ट बिकॉज वो नशे में धुत होके इधर उधर नहीं घूम रहा होता, इसका ये मतलब नहीं है कि उसने अपना को डैमेज नहीं किया, उसने अपना को अल्कोहल से भी कहीं ज्यादा डैमेज कर लिया। लिवर तो रीजनरेट हो जाता है, ठीक है, दैट्स फाइन, बट लंग्स रीजनरेशन में नहीं जाती। तो स्मोकिंग तो एक ऐसी हैबिट है, जो जो स्मोकर है वो स्मोकर ही है, उसका अल्कोहलिक से ये बहुत एक्चुअली मेरे को पॉइंट अभी आया माइंड में कि स्मोकर तो को तो आप एक क्रॉनिक अल्कोहलिक से ही कंपेयर कर सकते हो, एक स्मोकर को आप सिर्फ एक क्रॉनिक अल्कोहलिक से कंपेयर कर सकते हो। लॉट ऑफ पीपल माइट बी गेटिंग ऑफेंडेड टुडे, राइट, एज अ रिक्वेस्ट टू बी इन योर लाइव वीडियो, एब्सोल्युटली सूर्य, लेट्स गेट यू लाइव नाउ। कहाँ है भाई? आ गया
अभी सुन रहे?
हाँ सूर्य, हाँ जी, हाँ, सो व्हाट डू यू हैव टू शेयर टुडे?
No, no, I have to come to defend alcohol.
अच्छा, कम ऑन, स्टार्ट ऑफ।
Nee, that's what, man. I mean, banning alcohol and shit like that. That is fucking very fierce. Alcohol.
समथिंग स्टॉप फॉर सम रीजन,
है
आई थिंक
you're
कुछ ब्लॉक
okay,
आया है
fine, ये
अभी।
रहे ना, मेरा वाला ठीक है. I think he's you've been hung up, bro. I don't know. Thanks, Tanya. Thank you.
हेलो।
Absolutely. Addiction is a disease. Like you said, alcoholism is a problem. But if
यस,
you compare if you compare alcohol and tobacco and smoking, we are talking about smoking. So you cannot
यप,
be as radical and as extreme when talking about alcohol in the same way. Dude, alcohol is much less this thing aggressive than this
एब्सोल्युटली,
thing than the tobacco.
बट द पॉइंट इज,
you
ये बात तो आई आई
you
आई
see
एम
the organ,
एग्जैक्ट,
you
हाँ,
you see the organ that it is affecting upon. That makes the entire difference here. People who
एग्जैक्टली,
do
यू आर
not
राइट,
people who do not know the intricacies of the human biology and anatomy and physiology cannot comment on what should be banned and what should not be banned.
एब्सोल्युटली राइट, एब्सोल्युटली एग्रीएबल,
Get your
एंड
no,
बट
they should
दैट,
get their facts clear first and then kind of comment on all this by using such strong words such as ban. You tobacco, yes, you should ban tobacco. That is when we say that, that is absolutely fine. But how can you say ban alcohol? Like, ठीक है, गुजरात में किया है, all those things, whatever it is there. But then, like you said, alcohol, अपना दिमाग होना चाहिए ना कि कितना करना कितना नहीं करना. इतना थोड़ी के सब कुछ चक के बैन करी जाओ. There are
बिल्कुल
then
ठीक,
no, this will have repercussions. If you ban alcohol, then there will be worse things coming into play. No, I am not angry. I am not angry. I am just bringing out my point because there are some things which need to be taken into
addressed,
moderation and in a very very diplomatic way. Everything cannot be dealt with very very extremist
aggressive
attitude.
means, yes.
Mera that's my viewpoint. Anyone has to criticize it is
No,
most welcome.
what I only I don't criticize it, I in fact agree with it, But the point is that yes, she said that alcohol destroys a lot of lives. I would say alcoholism destroys lives, not alcohol
Absolutely.
itself.
Oh, I love alcohol. Beautiful soul, I love alcohol. And yes, alcoholism destroys, not alcohol.
Alcoholism. But I would also like to reiterate that although people who consume alcohol, not alcoholics, people who consume alcohol may be in different planes. Somebody who consumes occasionally, somebody is an alcoholic. A smoker is always a smoker. He is going
Smoker
to
is
get
always
his
a
hit
smoker.
every day. He is
Ah,
going to get
that,
his hit every day. And he is directly comparable to an alcoholic. A smoker is equal to
scenario.
alcoholic. I think this is something that everybody would agree, but a smoker is equal to a chronic alcoholic any day. He may not be loitering in
Uh-huh.
the streets, he may not be vomiting, but the amount of damage he's done to himself is anyways far more than that of an alcoholic. An
Yeah,
alcoholic can be brought back very easily. A smoker can never be brought back. Lost once, lost forever. That's what I've seen.
absolutely.
That's what I've always seen. People who quit for 1 to 2 years end up taking up the habit once again on the third year. And when they start off again, then it's 3 more years of smoking before they quit again.
Hmm.
अल्कोहलिक खुद को अल्कोहलिक नहीं मानता, स्मोकर खुद को स्मोकर नहीं मानता, बट द ओनली पॉइंट इज अल्कोहलिक खुद को अल्कोहलिक ना माने तो
तो
फिर भी
चल
चांस है
जाएगा.
कि वो बच जाएगा. बट बच जाएगा, अगर वो बीमार भी पड़ गया वो बच जाएगा.
हाँ,
बट अगर स्मोकर खुद को स्मोकर ना
स्मोकर.
माने ना, उसकी मौत तो उसने उसी दिन लिख दी जिस दिन उसने पहला जलाया था.
हाँ,
उसकी मौत तो उसने उसी दिन लिख दी. इट्स नॉट दैट कि सूर्या मेरा फ्रेंड है मैं उसके साथ एग्री कर रहा हूँ. इट्स जेन्युइनली ट्रू. एक स्मोकर ने अपनी मौत उसी दिन लिख दी है जिस दिन उसने अपना पहला सिगरेट चला दिया. I've come to a very radical critical point. A lot of smokers are getting offended already, I'm very sure. But that's the point of the discussion. I want to make tobacco chewers and smokers offended today, right? I want them
yeah, yeah.
to either feel
हाँ.
bad or just quit these two things because they're genuinely bad. I think there was this video we saw a while back of a few foreigners who were performing a ritual using tobacco.
Fuck, dude. That was
They
super
they
crazy, man. That's
they
super
just
cringe.
they were
He was
performing some ritual in one of these. I won't name the place. One of these religious places in India. These foreigners were performing a ritual using tobacco, which is not a part of the religion anyways. So probably some misinterpretation on their part. But then again, some people have also come
use
up with
your
the point
line.
that
They've used the this thing, the concept of India in a different way. What you told me that day.
misunderstood the concept of
Misunderstood the. Uh,
India itself. So,
hmm.
now going back to the topic, I think I've dealt about smoking. Now, tobacco chewing. Now, good you've joined in. You will be able to give me good inputs. Tobacco chewing is one thing
I
that,
came for the defense of alcohol. I might go
but
now.
now you'll be able to give good inputs. I think a lot
वो
of
तो
people chew tobacco because they're not able to get access to food. A lot of laborers have told me कि खाना खाने की जगह tobacco चबा लेते हैं ताकि उनको वो satiety center satisfy हो जाए.
yeah,
Is that
just a
true
mode of
actually?
probably even I have heard that once or twice, but that's just a mode of convenience for all I care, honestly, because that's just keep trying to defend your actions because somehow or the other, everyone who smokes knows that it's the bad thing. It's just possibly trying to defend your actions, whatever nonsense you're doing. Then this is the way you can kind of
As
justify that.
As far as, yeah, but as far as I think a certain section of laborers are concerned who've probably never been to school, who've lived in a tribal bandhu ke sort of belt or probably one of those areas which are not very well, developed and have probably lack of infrastructure or access to education. I think a lot of them end up in this habit. And by the time they come to our cities, they're
Hmm.
already having a lump in their mouth or they already have cancer, right? This has been seen multiple times.
I'd like to correct you here because which is a myth most commonly used by everyone. It's never
Okay.
a lump in the mouth. It's an ulcer in the mouth. It can be a lump
Ulcer in the mouth,
anywhere in
right?
the body where you can't see it.
All right.
But where you can see it, like oral cancer, the advantage of oral cancer is that you can actually visualize it. So that is called mostly an ulcer. So I'm just correcting that one word. Baki to continue whatever you're saying is absolutely fine.
Yeah. So probably you see the ulcer in the oral cavity, and That's the point. By the time they come, they say कि मुंह में छाला हो गया. I think some people come like that, right, to you.
Every
They don't even realize
everyone
that they have cancer.
everyone comes like that. Everyone comes like that. So what
But
I'm
then
trying to say is that more than illiteracy right now, it's the kind of this thing pukri. Everyone wants to,
हाँ
the
हाँ हाँ
peer
हाँ हाँ
pressure and the pukrapan is like, and like Tanya just correctly mentioned, it's cheap as fuck, and it's readily available, like at every nook and corner it's available, bro.
every nook
So
and
like,
corner, yeah.
हाँ, बंदा दारू लैन जाता है, बंदा सिगरेट चाक दिंदा नाल कि हाँ चल ठीक है सुट्टा मारते, क्यों भाई? नहीं मतलब,
And
it's a, and they have strategically placed the shops there also, कि हाँ wherever there's a ठेका you will find a this thing,
exactly,
सिगरेट का small ठेला
you'll
there
find this guy
everywhere.
with a ठेला and हमेशा वो साइकिल पे होता है.
रेड़ा जा लिखता हूँ ना मैं पीछे उड़
हाँ, पीछे खोला होता है उसने
हाँ,
और ऐसे, और कई
हाँ,
बार तो रेड़े के अंदर ही बैठा होता है. In
हाँ,
one or two. Absolutely.
यार, हाँ.
क्यों भाई,
यार
मेरी भी you wish to
यार
join
अब
in?
यार नहीं, अब ब्यूटीफुल सोल नु दारू ना बड़ी प्रॉब्लम ला दी मैनू, पता नहीं क्यों.
अच्छा, निरंजन सर क्या कह रहे हैं? What are your views on oral cancer detection strategies? I think that's a question to you, Surya.
Sorry, I didn't key water.
Niranjan sir has asked a question. What are your views on oral cancer detection strategies? And for those of you who have not been introduced from Niranjan Devekar, he is a very, very senior prosthodontist from Pune and he is currently teaching in Ethiopia. He has finished up a double
Oh,
prosthetic degree from Austria as well. So he's a double prosthodontist, two prosthetic degrees, one
fantastic, yeah.
from India, one from Austria.
Amazing
And
sir, amazing
sir
sir.
and sir is very, very senior. So he's asking you, what are your views on oral cancer detection strategies? Come on.
The views on it's very limited. It's not been undertaken properly. There are not enough strategies to actually materialize or capitalize on this particular aspect, because if you actually invest and do things on and work upon this just the detection of oral cancer, you can bloody prevent so many other complications regarding that, and even the aggressive nature of the disease, because cancer is very aggressive. And I've seen more or less, if you check in the grading and the histopathological this thing, I have checked more or less the cancers to be moderately or poorly differentiated. Like these are more common than well differentiated. So the problem with them is that they are very aggressive and they spread very fast. There have been things like toluidine blue staining. People do thesis, people do studies on toluidine blue dye. Say, you kind of, but you can already see if there's a cancer in today's economic this thing. If they're more or less poor people who are coming, and they will come because of lack of awareness. They will come at a stage when you can actually see the oral cancer. So if you talk in a very
Hmm.
general way,
Yes.
uh, whenever a patient comes, you're able to see कि हाँ जी ये cancer है. Now sometimes when it's doubtful, then there is a this thing leukoplakia and stuff. There will be a white patch, and then you accordingly
Hmm.
manage it conservatively first, then take a biopsy and stuff. So the one thing which people do not know is that an ulcer, oral ulcer that does not heal for like 3 weeks is something very suspicious. This one line is very I mean, this is not, man, people don't know about this, because anything even a week old aphthous ulcer, they consider it to be very this thing, what is it? And some people, even for 5 months there's an ulcer, they don't care. So that is those are the two extremes. So yes, absolutely, the concept about awareness, the concept about early detection is very minimal in today's scenario, especially in North India. Trust me, in South India they have still kind of developed, and they've made out these like techniques, and like the blue toluidine blue thing I was telling you, they do it in their clinics also. But what I saw and
Okay.
I felt was that you
In the
really don't need to
clinics.
do it. They do it. Yeah, it's just a damn dye, man. You just place it and then you make a slide. And I don't know what exactly histopathological what they do, but yeah, that's a way of detecting. The most important thing is a punch biopsy. For oral cancer, the most important thing is a punch biopsy. And trust me, no offense to anyone, more than 80% of general practitioners do not know how to take a punch biopsy. I have seen that. And you have been there at Dharamshila. You know about how we used to talk about all this.
Absolutely.
So
Absolutely true.
so yes, there has to be bigger this thing, wide variety and bigger consensus about how to actually create all this awareness and deal with this. So because if you stop it early, then you can actually prevent the progression, or even the you know sorry, you can prevent the progression.
All right. So one more question comes to you. How many oral
Mhm.
cancer cases due to smoking versus chewing tobacco, Dr. Surya?
So then I cannot actually comment on the figures right now, but when it comes to smoking, there have been cases which are in the entire body, because smoking affects the body as a whole. You can have oral, you can have lung, you can have throat, pharynx, larynx, PFS, and anywhere else in the body. But when it comes to tobacco, it's more or less limited to the oral cavity. So now with tobacco, it's a very interesting scenario that there are people who chew tobacco and spit it out, and there are people who chew tobacco and swallow it. Now, when you spit it out, the cancers that you see are more commonly on the anterior part of the mouth. But when you uh, chew it and you swallow it, then at the posterior part of the mouth. And that posterior part of the mouth can lead to the oropharynx, the base of tongue, the retromolar trigon, and all those things. So,
Velopharyngeal appliance, right? That's where you give that.
that case, yeah. So basically, you cannot actually quantify this unless you do a very big study, or unless you actually look into it. But on a whole, in general, if you're working in a surgical onco unit, which I'm grateful that I am right now, so then you see that all the cases for the entire body are being caused due to smoking in some form. Now, tobacco will only lead you to oral cancers most of the times.
I
So
think
yeah, that's
Tanya
the
is asking that. Yeah,
it's I think it's
that's the
just
crux of
not about
matter.
cancer. People are
People
ignorant about oral
ignore
health in general.
lack of awareness.
Lack of
Yeah, that's true.
no
That's absolutely
nothing
true.
nothing can happen for lack of awareness. You put up camps, nothing will happen. Two people will be affected by that. I mean,
Yep.
it'll take you 6.5 light years to kind of uh, cause this awareness. But हाँ ठीक है, camps and regular. Um, I mean, I don't know, man. It's just that probably. Uh,
Oh, ये क्या हुआ? Just 1 minute. I think I'll just add Surya back. I don't know what just happened. Somehow we just got disconnected. Something at this end. All right, I've sent in an invite request right now. So yeah, because there are two more questions for him that are coming up. Rest of it, okay, पता नहीं क्या हो गया. Yeah, I've sent in a request for Surya to join in.
I'm
I
yeah
don't know what
yeah.
happened.
I'm sorry. Yeah, I don't know the connection or something. The battery is low. What happened? Huh.
Acha, acha. So, Niranjan sir wants to ask you one more question. What are your views on Veloscope, on Wellscope,
Oh,
PEL
Wellscope.
scope?
Wellscope. I think it's a this thing. It's a newer technique. I am not much aware of it, sir. I'll totally look it up and let you know about it. But I haven't personally seen anyone using a Wellscope in my vicinity, or in where the this thing where I worked or where I trained. But nevertheless, I think it's a this thing. What I was talking about, the blue toluidine blue. Why they use a blue? This thing is it has a deeper wavelength, so you can actually view the this thing in deeper in deeper tissues as well. So Wellscope probably uses a light with a deeper wavelength, and probably that is much more sensitive. I do not know the technical intricacies of this as well, because I have never used it or seen it being used. I'll definitely look it up. So thank you for the question. Actually update myself on it. Thank you so much, sir.
So is early detection or screening the key? Niranjan sir is really I guess.
Sir, it is the key if it's pulled off correctly. Because I mean, absolutely, because early detection when coming to oral cancer is actually very easy, because like I said, something that you can view, as compared to cancers in the other part of the body, like deep in the abdomen and gallbladder. Gallbladder cancer is the most aggressive cancer, so you do not know about it. You do not get to know about it unless some people have jaundice, some people have
Surya,
pain in
I
that
think we've
area.
lost connection with the microphone. Can you hear me? Can you hear me?
Yeah, I can hear you. Can you hear me?
I can't hear you.
I don't know. Anyone else is feeling the same thing? I don't know.
I'll just
Can
reconnect you. I think I'll just reconnect you.
yeah, man, fine. Okay.
Can everybody else hear Surya? Can
मेरा तो ठीक है
everybody
यार.
else hear Surya? I think probably.
हाँ यार सुन रहे हैं.
I don't know.
अपना ठीक
Both
कर
are
तू.
audible. All right, you can continue.
हेडफोन ठीक कर अपना.
Probably some error over here.
Your headphone.
So
अच्छा.
all right.
Anyway, so yeah, if it's pulled off correctly, then yes, absolutely, early detection is the key, sir. But it's it's not being followed very aggressively. It's not being, and there are a lot of things which are negative versus a lot of things that you can do which are positive. Like there is more publicity of the negative things rather than negative things like the marketing and the publicity. This thing, the marketing or awareness regarding to detection and prevention of cancer. So yes, that is the key,
All
sir.
right.
Like answering your question again, that is the key. But I just hope it gets followed by actual regular this thing, because hospitals do not do anything. It is you on an individual basis who has to try to, because this is the reality right now in even private setups, in even a charitable setup, that you do camps, you go to a certain place, there is hardly anyone who appreciates that, or anyone who follows up after that, to be saying it correctly. However, if the hospitals, if they kind of take an initiative, not just for one day in 3 months, like one day every week, that is an over 5 years you can probably expect kind of a change in the trend in the detection, and because that is the most important.
So yeah, what is the risk percentage of can we do more jointly for early detection?
And we do more jointly. Yes, sir. That is like I told you. If probably if you are at a this thing at a setup which is very very cooperative, then maybe we can actually influence that setup, the authorities, to kind of uh, help us with setting up not just camps, but of certain awareness drives, of certain regular this thing checkups. And if I'll tell you actually what the thing is, sir, that if we actually just focus on oral cancer na, the patients and the entire the amount of people who are trying to come in will be reduced. If we focus on cancer as a whole, the entire body, whether it's lymphoma, whether it's like any damn blood cancer, or whether it's any solid organ cancer as well, then probably it will be more fruitful, because then you can get cases which will be oral, which will be non-oral as well. Absolutely, sir. National regional registry, absolutely, it's not there. And I'll tell you one more thing. There is something known as this Ayushman scheme. Now, Ayushman scheme, they've recently revised the rates, but this they cover every damn surgery, every damn medical procedure. But when it comes to cancer, they cover like a commando surgery, which probably is like 2.5 lakh at a decent setup. This is 2 to 2.5 lakh is the minimum cost that I'm telling you. The Ayushman, if you're joining all the mandible segmental section and wide local excision and neck and then even a flap, everything joint comes down to just 60,000 rupees. Now that 60,000 rupees, that is the maximum you can achieve by a patient who is coming under the Ayushman scheme, and everyone is poor today, and everyone is almost getting a Ayushman scheme. So technically, in all the hospitals, people under the Ayushman scheme, which is like around 60 to 70%, they are not getting operated in terms of cancer surgeries because it is not paying. The hospital, out of this 60,000, the hospital will take up, I mean, 40, 50. What will be there for the surgeon? Nothing. So, but the rates, recently, I guess there's a urologist who's heading the Ayushman scheme ka rate list. So he's made all the urology ke procedures very, very high, the price. So the government is paying that. So it's very paying now. So that's what these rates have to be revised. So it's all a very, very vicious cycle. Everything is kind of related, interrelated, and yeah, it starts from detection, ends up till the payment. Everything has to be taken care of, and it all has to get an upscale in toto. I don't think if you raise one thing, the other thing will not be affected. It'll possibly be not taken care of. So the entire thing remains at the same level. That's what I feel.
I think there's one more question that what is the risk percentage of developing cancer for a passive smoker? Now this is being asked by Beautiful Soul again.
I don't know. I read it somewhere. I guess it was like 13 to 17%. I read it in Devita probably. I'm not really sure about the figures. But yeah, 13
I think
to
13 to 70 is
17%.
again quite a decent number, isn't it? Like 13 to
Yeah, so 13.
17%, that's a big chance.
So you can, so Beautiful Soul can continue with passive smoking for a while. It's just 13 to 17%. I'm
I think
sorry.
most of us would say, yeah,
I'm just
13 to
kidding.
17 ही तो है, इसमें क्या हो जाएगा?
I'm
But
just
13 to
kidding.
17 is actually quite a big proportion if you look at it. You
Yeah,
have a lot of,
absolutely, bro.
yeah,
Absolutely.
you
This
know,
was this was like in the 2012 edition of Devita that I joined, that I read a while back. I think the figures have probably been revised, and it could be more or less. Have to see it actually. Thank you, sir.
okay,
Thank you so
Niranjan
much.
sir is thanking you, Surya, for all the comments and
Thank you so much,
on
sir.
the
Thank you, sir.
answers.
Thank you, sir.
And Beautiful Soul wants to know that, he's a passive
Yeah.
smoker, he's passive, wants to quit. So,
Yes.
how to quit passive smoking?
So Akanksha here is from oral pathology, and she's a fantastic pathologist, and she's worked with me in the cancer hospital as well. So if she approves of this, that 13 to 70, yes, approximately, but depends on the genetics as well. So yeah, then I am correct. Yes.
Who knows, percentage might fall in 13 to 17. You might fall in 13 to 17 because we will surely brainstorm how we all like-minded can contribute for early detection. Yes, sir, definitely.
Absolutely, sir.
Definitely.
Absolutely, sir. Absolutely, sir.
And
Hmm.
so I would not end the session right now. I think we're having a very good session. And I think
बस यार.
today being World Environment Day.
Huh?
Something else that I want to mention about smoking is now how does smoking affect the environment? Probably this is something that very few people know that in the hilly areas, a lot of you have already heard of
चिल्लम.
forest fires.
हाँ.
Can you hear me?
चिल्लम में. हाँ, बोल.
पहाड़ी इलाकों में बहुत सुना होगा कि वहां पे फॉरेस्ट फायर हो जाती है.
हम्म.
ठीक है. फॉरेस्ट फायर कैसे होती है? It's mostly these shepherds or herders who end up lighting a cigarette and they throw the cigarette butt or which still has a spark or something into the dry leaves. All right. Because of
Sure.
that, this has been a cause of multiple forest fires throughout hilly areas, especially in India, that the smoker ended up coming, smokes a cigarette, leaves it half burning in the forest, goes ahead. By the time he is probably a kilometer ahead, half the forest behind has started catching fire.
I didn't know that. अच्छा.
And multiple stretches of land have been lost because of this reason. And one of the biggest causes
Quite
of
possible,
forest
yeah.
fires is shepherds smoking who end up leaving the cigarette butts in the forest.
And there are dried leaves, so they catch fire easily, I guess.
dry leaves, or probably initially the dry leaves will catch fire, then eventually the trees catch fire as well. And it's not just one isolated stretch. I remember when I was in class 3 or 4, there was this forest on fire, and audience sir is laughing. Yeah, man, I'm laughing. It's nice to look at from a distance. I know it's a danger for the people in front, but
From a
you
distance.
know, when you look at that patch on the hill which is burning all bright, wow. It's quite a sight to look at. Not that it's a very good thing for anybody who's lost their land in that forest, obviously, that's a different story altogether. So that's one more way smoking actually ends up indirectly harming the environment. Smokers end up indirectly harming the environment by reducing these huge patches of forest to ashes. So we've already seen these Amazon forest fires. Now, one cause of the Amazon forest fire was that somebody deliberately lit them on lit up the forest. One of the etiologies that eventually came out was that uh, these people who were living within the forest, the officers who were living, or probably some people around it, were actually smoking and smoking. And that's one of the theories behind it, right? One of the very, what should I say, an outlier theory, not a generalized theory, but an outlier theory was that it happened because of that. So, coming to one more topic, I have this question now. This is to you, Surya. Probably you have been observing a lot of cancer cases continuously. So, whenever you see people chewing tobacco, एक चूना लगाते हैं, है ना, tobacco पे. तो जो लोग लगाते हैं नहीं लगाते, उससे कुछ फर्क पड़ता है इनके? Is a person who uses tuna, is he more likely to get oral cancer than a person who is not using lime, या जो भी इसको slate lime कहते हैं, चूना कहते हैं?
I don't know, man. I don't think so. Because tobacco itself is the culprit.
Tobacco itself is an agent.
So I don't know if it has a synergistic effect or not. I never really looked
Because
into this.
what
See,
we were probably told.
I think of it in a very, very practical way, yaar. Banda hai tobacco lita, they are coming with cancer, you bloody operate or treat them. That's about it. Now, what tuna, and I don't know. I've not really kind of actually looked up into it, or kind of but I don't think it'll have a synergistic effect. Lime usually does. I mean, lime and stuff, those things have, but like in OSMF also, it has a role. But I don't know if probably has a 1 to 2% probably if I just kind of.
HPV virus is also, Ranjan sir has asked one more question. Is HPV virus also a contributing factor?
Yeah. It
Yep,
is. It is.
it is. जर्दा क्या होता है सर? इसका तो एक ही आंसर
Yeah.
है, जर्दा क्या होता है भाई?
Yeah.
हम तो नहीं बेचते, हमें नहीं पता.
यार कितने आई जा रहा है, मैंने तो दिख ही नहीं रहे कोई कमेंट खड़ जा मैंने.
वन मोर क्वेश्चन के सर, जर्दा क्या होता है? मैंने कहा हम तो नहीं बेचते यार, हमें नहीं पता जर्दा क्या हो.
जर्दा.
It's one of the I think forms of tobacco itself, right? जर्दा जो होता है.
No clue, bro. I don't know, man. Probably. I mean, it's an open forum. Anyone can tell us, yeah. Whoever knows.
Yeah.
I'm sure.
Anybody else who wants to join in? ये क्या HPV cases have better prognosis, though, according to studies. All right.
Most of
So
the
anybody who
people
wishes to join in can join in right now. Free to join in.
Yeah, I'll come again because I cannot, kind of view anything. 1 second.
So I think we're having a very informative session today, and this is exactly how I wanted it to be. I wanted it to be very, very highly interactive, and I wanted people to come and ask questions, and yes. So I think lime fluid, yes, absolutely. On application, it does more harm to the mucosa, probably making it more, sort of permeable to the toxic components of tobacco. Zarda is a form of tobacco only. Okay.
Speaks Akanksha.
All right.
चलो यार, let's call it a day now. बहुत हो गया.
Yeah, बोलो.
I said let's call it a day now.
Yeah, that's what I was about to do. Thank you for calling my question silly. I'm enjoying
Not
being
calling my
here.
question silly.
Not calling my question silly.
That's
That's
the only thing we didn't do.
yeah, that's true. Jarda is equal to raw tobacco. All right, sir. Niranjan sir has answered that question. Jarda is equal to raw tobacco. I
We are
think we
very
had
good.
quite a
We are
session
very.
here today. Right.
We are very.
This is exactly how I wanted it to be. I wanted to be highly interactive where people join in, come in, answer questions, ask questions, and there is debate and all of that, all these components combined. That's how I planned this event to be, and that is exactly how it's come out to be. So, first of all, Surya, thank you for coming in and for the very, very highly active participation that you've given today to this event. And you wonderfully answered all the questions that were asked today.
Yeah,
And
I
not
would.
only
I
that,
would. हाँ बोल बोल तारीफ कर बोल बोल बोल.
matlab, I also want to thank everybody else who's come in today. All right, Niranjan sir, Dr. Prabodh Sen, they asked the questions asked by both of them were highly relevant. Beautiful soul, yes, you did ask questions, and all your questions were highly relevant as well.
See,
Thank you for coming in.
Akanksha is seconding me in almost
Akansha is there.
everything. Thank you,
Nahi,
Akanksha.
Dr. Akansha is there. I'm going to mention
Lime,
everybody one after the other.
lime
Dr.
has
Akansha.
calcium that acts as a cofactor in pathogenesis of OSMF. So yeah, like I told you, OSMF. It probably has this thing. Uh,
Yep.
hmm.
So many people joined in today. I think a lot of
I,
people came in. They came
I,
in
I
on
would
and off.
I would want even more people to kind of come in live in the come on the
I
video
would
in the
really want
live and
that to
stuff.
happen, but not
So
many people decided to come in live today. So probably next time when we'll have a sort of a symposium, we'll plan it out in advance as to who is coming live, and then we'll keep one space open for guests who can always keep coming in live and leaving.
ठीक है.
So that sort of an event is something that's been on my mind for a while now. So today, I would say, was somewhat a trailer of that kind of an event that I wish to have in the future. It's a proper symposium sort and a debate sort of discussion. Because that's what makes things interesting in the end of the day. So thank you all for joining in, and today let's
Thank
all just
you.
take this one sort of pledge that if we are not able to make a person quit tobacco, let's at least make it a point that wherever we see it, and in whoever's hands we see a cigarette or we see a packet of tobacco, let's just make it a point that come se come, at least
I
we
just
should
show
tell
them.
them,
I just show them the surgery videos and they're flabbergasted by that. I have this one thing to do.
yeah. So that's what I'm telling you. We also just be absolutely, कम से कम उनको इतना बोल दो यार कि इसके harmful effects क्या हैं और कुछ मत बोलो. Because if you tell a person ये करना बंद कर दो, I'm very sure उसको 8 बंदे उसकी कंपनी में भी बोलते हैं कि करना बंद कर दे. But जब तक कि वो डॉक्टर के मुंह से जब सुनेगा तब असर पड़ता है. That's when it makes the difference. क्योंकि वो वाकई में तुम्हारी बात सुनेगा. एंड एक बारी में उसके भी मन में थॉट आएगी कि शायद मैं कुछ वाकई में गलत कर रहा हूँ. So that's about it today. Thank you all. Thanks a ton, everyone.
I will always have my loyalties towards alcohol that brought me to this session today.
That's absolutely fine. That is
Just kidding,
absolutely
bro.
fine.
Chalo. Okay.
That is absolutely fine.
Chalo.
So let's call it a day. And thank
Yes.
you all for joining in. Thank you, Niranjan sir. Thank you, Surya. Thank you,
Thank you, everyone.
Prabodh.
Thank you.
I have multiple names to take. Beautiful Soul, Tanya, Harshit, Swati, Sahil Thakur. Thank you all for joining in. I may not have taken all of your names, but I'm very happy that you came in today and attended this live session that I wanted to have for a long time. Sir Mukesh नहीं समझ पाया हम कैसे कर पाएंगे. हम कैसे कर पाएंगे? कौन मुकेश कौन है?
Ad नहीं सीगी यार.
अच्छा.
Oh, that was that stupid ad which used to play in front before the movies and stuff, na.
हाँ वही बात है. मुकेश नहीं समझ पाया हम कैसे कर पाएंगे. हाँ. The same ad has been there in theaters for the past 12 years. That means मुकेश के अलावा किसी को हुआ ही नहीं. मुकेश के अलावा हुआ नहीं किसी को.
कोई पेशेंट है पूरे इंडिया से. एक पेशेंट.
वो पेशेंट ही था क्या सिर्फ कैंसर का? कि बाकी लोगों को तो यही लगेगा ना जो जमाई नहीं पढ़ाई करी हुई कि मुकेश के बाद तो कोई हुआ ही नहीं. अल्कोहल पे सेशन करते हैं यार. देखो मैं एक बात बताता हूँ. तो शायद आप पहली बार ही आए हो. शायद आप पहली बार ही आए हो। यहाँ पे ना हम जनरली वो डिस्कस करते हैं डेंटल और डेंटिस्ट्री रिलेटेड टॉपिक्स। ये सोशल डिस्कशंस का फोरम नहीं है समहाउ। आज सोशल डिस्कशन बन गई वो अलग बात है, ये टॉपिक उस
ये
टाइप का था।
नहीं नहीं, अगर ऑंको की बात भी करते ही हैं, चलो ठीक है, वो अलग बात है, बट अगर अल्कोहल का एक टॉपिक रखेंगे ना, वील डिसाइड a bourbon is better, a single malt is better, a scotch is better.
हाँ,
We'll
यही
do
सब
that.
हो सकता है उसमें
We'll do that.
तो।
We'll do that.
यही सब हो सकता है उसमें तो। उसमें मीम बन गया, हाँ उसका मीम बन गया, बिल्कुल ये तो है। चलो,
चल
गुड नाइट
ओके यार,
एवरीवन, हैव अ
गुड
ग्रेट
नाइट
डे,
यार, गुड नाइट,
हैव अ गुड नाइट एंड हैव अ
ओके,
ग्रेट डे टुमारो। यस, ऑल राइट, सी
बाय।
यू गाइस, बाय बाय, आई एम गोइंग टू कॉल इट ऑफ।